Hi friends, welcome back to my channel. Today I'm going to discuss about the oxygen therapy, which is a clinical skill in Nmc Osce. So let's read the marking criteria first and we will discuss in detail. First of all, it is a 10-minute session. So what you have to do? First we have to gel our hands using 6 steps of hand hygiene and check the scene for safety issues. We can tell them like that I am checking the area for safety and it's safe to approach. Then we have to introduce ourselves. Hello, my name is so and so. Then I am your nurse today and I am here to help administer oxygen therapy to you. Then we should ask the consent. So is that okay? We can ask them. That is the thing they are explaining here. Explain the procedure to the person and discuss it with them. Then next is that they are telling before administering any prescribed drug, looks at the person's prescription chart, checks that all the followings are correct. Here they consider oxygen therapy as well as a medication. So without any doctor's prescription, we cannot start the oxygen, but there is an exception. During emergency situation, we can start it, but later on they can document it. So we will get a prescription chart. So what all things we have to check? So we should ask the patient his name. Then we should cross-check it with the ID with the person verbally first, then against with the wristband where appropriate and documentation. Then we should check what's the target saturation they have documented. Then what is the device? Is it a nasal cannula or venturi mask or non-rebreather mask? Like that, what is the flow rate? Is it 2 liter per minute? Is it 15 liter per minute? Usually they are providing this non-rebreather mask that will be 50 liter per minute. Then date and time of administration, when we should start, is it due now, like that. And don't forget to check their allergies. Then we can, how we will meet this marking criteria. We can tell them, for safety purpose, can you tell me your full name and date of birth please, and can I check your identification band if there is one, and if it's in community you don't have any identification band, so you can ask the name and date of birth verbally. Then do you have any allergies that you know of? Okay, that matches with what I have on your drug chart, so we can inform them like that. Then we should read out the target saturations are, the device and flow rate is, the date and time of administration is, like that. You should read loudly so that assessor can hear it is. Then we should check the prescription for, check the validity, that is the next criteria. Correctly check all of the following: validity of prescription, signature of prescriber, prescription is legible. If any of these pieces of information is missing, unclear or illegible, the nurse should not proceed with administration and should consult with the prescriber. So we should check all and we should inform the prescription is valid, because these all things are present, like that we can tell them. Next, again before we start the procedure, we should do the hand hygiene. We can use the alcohol gel. Then identifies and select the correct equipment, usually the reservoir mask, that is the non-rebreather mask, and assembles and attach tubing to the flow meter. They will arrange all things, but we should ensure that everything is there. Nowadays they are providing all equipment is arranged on it like that. So you can connect the oxygen and tubing to the flow meter. Then don't forget to turn on the oxygen, select correct flow rate. Then another thing you have to do is that for the non-rebreather mass, as I mentioned, usually we are putting 15 liters per minute. Verbalization is accepted, which must contain explanation of method of measurement. Then demonstrates covering the one-way valve with fingers and verbalize that they would do this until the reserve bag is fully inflated. So most of the time Many students are forgetting these things. This one you should not forget. Okay. But one thing I can tell you, if you forget something in between and later on you remember that, before finishing this scale, you can't apologize and actually I forgot to do the hand hygiene. For example, I am telling, so you can tell in the real scenario, I won't do this. I really apologize for this happened here like that. They will accept it. Okay. Then we will ask him to sit in the upright position, which will be comfortable. So if he is not able to do that, we can assist them. Then applies the oxygen mask by placing over the patient's nose and mouth. Then pulls the elastic strap over the head and adjusts the nose brace and straps on both sides to secure the mask in a position that seals the face, but it is not too tight. We should ask them, is that comfortable for you? Okay, we should always ask the patient's consent and we should encourage the participate. Okay, then ensures that the chosen delivery method is comfortable for the patient and states that you will reassess the saturation to check whether they are within the normal target range for the patient. For example, it's 94 to 98 percentage, escalating if this is not achieved. This is the another important thing you don't forget. You should tell them, I will reassess the oxygen saturation to check whether they are within normal range. Otherwise, I will escalate it to the doctor. We are just giving reassurance for them. Then I will check the skin around your face, nose, ear, and back of the head, and provide mouth care regularly. We should tell that one also. Then we can give some health education to them. We can tell, as it is a dry oxygen is dry, yeah, so you can drink plenty of water as per doctor's order. Then we can tell you can apply some moisturize like that. Then especially we should tell, don't use the Vaseline because petrol in jelly can cause burns because he is using oxygen. Any other moisturizing cream they can use to prevent dryness on the lips and nose like that. Okay. Then oral hygiene we should tell, we will provide regular mouth care because it will be dry. So then we will assess the skin for any skin breakdown because of the ear strap they are using. Then next thing we have to do is that signs and date the drug administration record. So that's the thing. Then you can tell them, assessor, the procedure has been done and documentation done and is completed, and I will make sure that the tray is ready for next use like that. Okay. So this is the thing for oxygen therapy. So what you have to do, just look at the marking criteria and try to practice it. That's it. You can pass in your first attempt. And if you have still some queries, you can comment below in the comment box. I will try to answer it. Okay. Thank you very much for your support and keep watching and share with your friends. Those who are going to attempt the OSCE, it will be beneficial for them. Thank you. Thank you very much for your support.